Good morning, everyone. On behalf of the City of Laredo and Laredo Public Health Department, I would like to welcome all of you to today's Binational Campaign Press Conference. We are honored to have everyone here joining us this morning as we highlight an important collaborative and important effort focused on public health awareness in our border community. Today's event reflects the strong partnership between our city and our sister city, demonstrating how cross-border collaboration can strengthen education, prevention, and community health outcomes. At this time, I would like to introduce our first speaker, Dr. Richard Chamberlain, who is the director of the Laredo Public Health Department. Dr. Chamberlain has played a critical role in advancing public health initiatives across our city and strengthening collaborative efforts that promote prevention, education, and community well-being. Please join me in welcoming Dr. Richard Chamberlain.
Thank you, Deidre, and thank you everybody for being here this morning. The top 3 notifiable infectious diseases in Webb County are sexually transmitted infections, with chlamydia being the most prevalent, followed by gonorrhea and syphilis, which alternate in rank from year to year. These infections are preventable, and that's why education, testing, and early treatment are so important. Today, we are launching a unified communications campaign focused on strengthening congenital syphilis, because this is a serious and preventable public health issue affecting families across Texas, across the border region, and even right here in Los Dos Laredos. The campaign is being carried out in collaboration with our valued partners in Nuevo Laredo, the Secretaría de Salud, Jurisdicción número 5, and el Gobierno de Nuevo Laredo. The partnership reflects our shared commitment to protecting the health of mothers, babies, and families on both sides of the border. Our goal is clear: to raise awareness, encourage testing, connect people to treatment, and prevent congenital syphilis before it harms children and families. The data shows why this matters. According to the Texas Department of State Health Services, they reported 530 congenital syphilis cases in 2019, 565 in 2020, 689 in 2021, 922 in 2022, and 930 in 2023. Texas is also being affected at a higher rate than the nation overall. The congenital syphilis rate in Texas was 230 per 100,000 births in 2022, when compared to the United States national rate of 102.5 for every 100,000, a significant disparity. This is not only a statewide issue, it is a regional and local concern. In Public Health Region 11, which is right here in South Texas, there were 122 congenital syphilis cases reported in 2022, with a rate of 369.7 per 100,000 live births, well above the state rate. In 2023, Webb County was listed among the counties with the highest congenital syphilis burden, with 21 reported cases. DSHS border data also shows that Webb County's syphilitic stillbirth rate reached 61.8 per 100,000 births in 2023. Behind every number is a child, a mother, a family. Congenital syphilis can lead to miscarriage, stillbirth, preterm delivery, birth defects, and infant loss. These outcomes are devastating. They are also preventable. That is the most important part of this message we want to share today. Congenital syphilis is preventable. While timely prenatal care, testing, and treatment, we can identify early infection and intervene before harm occurs. Texas law requires syphilis testing at the first prenatal visit and during the 3rd trimester, and again at delivery. These are critical opportunities to protect both mothers and babies. That is why Our message today is direct and urgent. If you are sexually active, male or female, if you have multiple partners, get tested regularly and know your status. If you are pregnant, it's important for you to seek prenatal care as early as possible and talk with your healthcare provider about repeat testing. If you test positive, get treated quickly and completely. Early action can protect your health and save your baby's life. Our response must match the urgency of the moment. This unified communications campaign is about making sure the public has accurate information, understands the risks, and knows where to seek care. It is also about reducing stigma and reminding our community that getting tested and getting treatments are acts of responsibility, care, and prevention. This effort is stronger because it is collaborative. Public health does not stop at the border, and neither should prevention. By working together with our partners in Nuevo Laredo, the Secretaría de Salud de Tamaulipas, Jurisdicción número 5, and el Gobierno de Nuevo Laredo, we are sending one clear message, a unified message. Early testing, early treatment, and shared awareness can and will save lives. Let me be very clear. This is preventable, and prevention requires all of us. It requires healthcare providers, public health agencies, community organizations, educators, families, and residents working together. We are here today because awareness matters, testing matters, and healthy births matter. Up here on the screen, of course, we do have what does congenital syphilis do? As we discussed in the presentation, how can you tell if I have syphilis? What are the signs and symptoms? And what is the treatment? This is all available on the DSHS Congenital Syphilis dashboard for anybody to review. We'll stand by for the actual graphics that will be shared in a few moments. I'll pass it back over to Deidre.
Thank you, Dr. Chamberlain, for your leadership and continued commitment to protecting and promoting the health of our community. Next, we are honored to hear from one of our valued binational partners. Representing our sister city, please welcome Dr. Irma Gladys Cano Ramirez, Director of Salud and Bienestar de la Jurisdicción Sanitaria de Nuevo Laredo.
Buenos días. Como ustedes saben, perdón, tenemos el convenio binacional para dar seguimiento a este tipo de enfermedades, como comentó el doctor Chamberlain. Nuestro equipo de salud del 5º distrito de Nuevo Laredo está muy comprometido con la salud de todos los nuevolaredenses, y es para mí un orgullo que mi equipo de trabajo me acompañe, porque ellos están desempeñando en esta administración un excelente trabajo. Todos los programas se les está dando un seguimiento muy oportuno, como es el sífilis, el VPH, tuberculosis sobre todo, y actualmente, como mundialmente, tenemos la campaña permanente en los 15 distritos, el sarampión. Actualmente estamos casi el 90% de vacunación en todo Nuevo Laredo, y eso gracias al excelente trabajo que se ha hecho desde en los 3 niveles de gobierno, que son a nivel federal, a nivel local y a nivel jurisdiccional. Mis compañeros hoy de trabajo me acompañan, el doctor Francisco, la licenciada Edith, la doctora de epidemiología, nuestras excelentes enfermeras que están encargadas de la vacunación de Nuevo Laredo, que es la licenciada Adelina y la licenciada Carmelita. Y yo, la verdad, a todo mi equipo de trabajo le quiero dar un fuerte aplauso porque están sumamente comprometidos y Nuevo Laredo sigue adelante.
Thank you, Dr. Cano Ramirez, for your remarks and for your continued partnership in strengthening public health efforts across our communities. So if you would like to come up, we would like to mention again that that today's press conference marks the launch of the Coordinated Binational Awareness Campaign focused on STI, STD, and syphilis education and prevention. Through this initiative, both cities will share synchronized health messages every Friday for the next 8 weeks. These messages will promote awareness, encourage routine testing, reduce stigma surrounding sexual health, and provide residents with the information they need to make informed decisions about their health. This collaborative effort highlights the importance of shared responsibility in protecting the health of our border community. We thank all of our partners for their participation in today's event and for their continued commitment to improving community health. Thank you.
May I ask if the prevention team from Laredo, and of course de Nuevo Laredo, si podemos tomar una foto aquí enfrente de los gráficos que vamos a estar compartiendo entre los ambos Laredos. Come on up.